Hi, my name is Fernanda Garcia Perez. I'm going to talk about levothyroxine in women with thyroid peroxidase antibodies before conception. Definition. The presence of maternal antithyroid antibodies is closely associated with abortion and preterm delivery. Levothyroxine mitigates this risk. Thyroid autoimmunity is the main cause of hyperthyroidism, which in turn is the cause of poor obstetric outcomes, even in women with biochemically normal thyroid function. Studies have reported an association between the presence of anti-thyroid antibodies, especially thyroid peroxidase antibodies, and adverse pregnancy outcomes, including miscarriage, preterm delivery, and adverse effects of neurological development with sequelae in children.
The thyroid's a gland in the front portion of the neck, and it secretes thyroid hormone. This hormone helps control metabolism throughout the body. Hypothyroidism is having an underactive thyroid, not enough thyroid hormone. Hyperthyroidism is having too much thyroid hormone. When a patient is hypothyroid, they often can gain weight, feel lethargic or tired. They can at times have some hair loss. When a patient is hyperthyroid, they can at times feel like they are losing weight. They have shakes or tremors. They have extra heartbeats or palpitations or maybe hot flashes. The thyroid and the various thyroid illnesses can dramatically affect the success of a future pregnancy or an ongoing pregnancy. Thyroid hormone is required by the developing baby during pregnancy, and if there is not enough or if there is too much thyroid hormone, this can cause harm to the baby itself. If the mother is hypothyroid, the baby itself can be at risk for other potential harm. There can be an increased risk of miscarriage early in the pregnancy, and there can also be potential damage to the developing brain in the fetus, leading to other cognitive problems or lower IQ later in life. If the mother is hyperthyroid, there can at times be a risk of miscarriage or other pregnancy harm if the levels of thyroid hormone are excessively high in the mother. The baby can also be born with signs of Graves' disease or other signs of hyperthyroidism in rare cases. It's very important that the mother contact their physician or their endocrinologist as soon as they think they could be pregnant, because the increasing demand for thyroid hormone in pregnancy occurs very early, sometimes as early as 5 or 6 weeks of pregnancy. Our research here at the Brigham and Women's Hospital has demonstrated that the requirement for thyroid hormone goes up about 40% during the course of pregnancy. This is very important because some women do not have a functioning thyroid. If they are then taking thyroid hormone as a pill, they will need to increase the dose of that pill to be adequately normal throughout the course of pregnancy. This is very important for the baby and for the developing fetus. Any patient with a thyroid illness would benefit from being in close contact with their physician or with an endocrinologist who specializes in thyroid disorders. If someone suspects that they have a thyroid disorder, they should first reach out to their primary care physician or directly to an endocrinologist to discuss the issue. This will often lead to an examination and then some blood testing to identify if indeed there is a problem that needs to be treated.
Applications in medicine. Case control studies, the relative risk of abortion was 1.18. Regarding preterm delivery, the relative risk doubled significantly in the presence of antithyroid and antibodies. Randomized studies evaluated the effects of levothyroxine treatment on abortion. They showed a decrease in abortion rates, while the meta-analysis showed a relative risk reduction of 52% with the use of the levothyroxine. Relative risk 0.48. One study reported on the effect of the levothyroxine of the preterm delivery rate and found a relative risk reduction of 69%.
Welcome back. A lot of couples have a hard time getting pregnant and having a baby. Researchers say it could come down to an organ you might not expect, your thyroid.
This is where the thyroid is. It's located in the neck, and we have a right lobe, a left lobe, and then an isthmus.
Yeah, it's that butterfly shape there. The thyroid is a major regulator of the body. And according to endocrinologist Dr. Claude Lardinois, who's an emeritus professor at the University of Nevada's School of Medicine, Hashimoto's disease is an autoimmune condition where the body attacks its own thyroid gland. About 10% of women have this, he says. Even though their thyroid function may seem normal during pregnancy, their body could be silently attacking their thyroid, and the antibodies could endanger the life of the baby. So Dr. Lardinois says thyroid issues need to be addressed before you ever even start to think about getting pregnant. And all women who are of childbearing age, he believes, should be tested for this antibody. It's the thyroid peroxidase antibody, or TPO.
Studies have consistently shown that women who are antibody positive have a higher risk of miscarriage.
So if you're TPO positive and your thyroid hormone is elevated, then medication early in your pregnancy might be advised. Studies involving more than 12,000 women found that thyroid antibodies increased the risk of miscarriage by, get this, almost 300%.
Pros and cons. Pros. When taken correctly, levothyroxine reverses these symptoms: lack of energy, excessive constipation, weight gain, hair loss, dry, thick skin, increased sensitive to cold, joint and muscle pain. Cons. Levothyroxine can cause serious or life-threatening problems when administered in large doses, especially when taken with amphetamines.
Hi, I'm Dr. Mark Charles, Director of the IVF Center here in Orlando, Florida. Thyroid function is critically important for fertility as well as pregnancy health. When you have an abnormality in your thyroid, whether you have hypothyroid, which is low thyroid production, or hyperthyroid, which is elevated thyroid production, they both can affect your ability to have a baby. When your thyroid is not functioning properly, it can actually impair your ability to ovulate, reducing ovulation function, and infertility can result. So a simple blood test called TSH can monitor your thyroid and let us know if it needs treatment. Now, how does thyroid affect pregnancy? Well, we know that in both cases of elevated thyroid or low thyroid, you have increasing pregnancy complications, such as miscarriage and even preeclampsia and death of the baby. So it is vitally important to have good thyroid control prior and during your pregnancy. During the first trimester of pregnancy, baby actually relies on the mom's thyroid production for good neurologic and cognitive development. So the earlier that any thyroid abnormality can be detected and treated, the healthier the aspects of reproduction and pregnancy. There is evidence in the medical literature that your TSH level needs to be a little bit more controlled for pregnancy purposes than when you're not trying to get pregnant. The average TSH level should be between 0.5 and 5 roughly. But when you're trying to conceive, we actually like the upper limit to be less than 2.5 because it seems as though it could reduce the risk of miscarriage. So if your level is above 2.5, even though it's normal otherwise, we would actually want to put you on some low-dose thyroid hormone. And we recommend the brand rather than generic because the brand is much more tightly controlled to give you adequate levels.
Usually applied in Ecuador. According to the GARCÍA, this medicine, known in Ecuador as Euthyrox, is not authorized since its use can cause adverse effects.
It's the most prescribed medication in the U.S., with more than 120 million levothyroxine prescriptions written each year. The drug's purpose is to raise low thyroid hormone levels for a condition called hypothyroidism.
But the majority of these patients will be surprised that actually they don't need it.
Mayo Clinic endocrinologist Dr. Juan Brito says more frequent testing is partially to blame, as well as hypothyroidism's very common, somewhat vague symptoms.
Weight loss, hair loss, dry skin, fatigue, low energy, those are symptoms of many other conditions. Actually, there are symptoms such as life sometimes.
Dr. Brito says that's why many patients' symptoms don't improve with a daily pill. He urges physicians to have valid reasons for prescribing levothyroxine and to follow up in 3 months' time to see if the patient benefited.
And that is the key, is to reassess. The majority of patients get treated and never really have the chance to withdraw the medicine and then just get treated for the rest of their lives.
For the Mayo Clinic News Network, I'm Dennis Doda.
Conclusion. According to a scientific study, the use of levothyroxine in euthyroid women with thyroid peroxidase antibodies did not result in higher rate of live births than placebo and Science 2018. Levothyroxine is use decreased.
Hello, I'm Dr. Shivani Chandran, consultant obstetrician and gynecologist at Aster RV Hospital, JP Nagar, Bangalore. One of the most common medical conditions in pregnancy is hypothyroidism. Now let us look at what is hypothyroidism and why is there a need to treat this condition. Now, all of us have a thyroid gland, which is a butterfly-shaped gland situated in the front of the neck. It secretes the thyroid hormones. These hormones are important for metabolism and they regulate the functioning of most of the organs of the body, including the heartbeat. Now, when these thyroid hormones are secreted in a decreased amount, the condition is called hypothyroidism. Now, why is this condition important in pregnancy? The fetus, which is inside the pregnant woman, starts secreting these hormones only at the end of the 3rd month and is fully functional only by the 5th month. Therefore, the baby is dependent on the mother for the thyroid hormones until that stage. And this thyroid hormone is very important for the development of the brain and the spinal cord of the baby. Therefore, this condition is not treated very early, detected and treated very early in pregnancy. It can cause problems to the baby's development. Also, if it remains untreated, it can cause miscarriages in the pregnant woman. It can cause increased risk of developing BP during pregnancy. It can cause low birth weight IUGR babies and also anemia. Anemia is a condition where the hemoglobin is reduced. Now, coming to how can we diagnose this hypothyroidism? Unfortunately, it cannot be diagnosed only based on symptoms, since some of the symptoms of hypothyroidism are similar to the symptoms of pregnancy. For example, constipation, weight gain. All these are likely to occur even in pregnancy. That is why that as soon as your pregnancy test comes positive, it is important to do this blood test called TSH, which stands for thyroid stimulating hormone. This hormone is required to be less than or equal to 2.5 in the first 3 months. In the middle 3 months, the target is up to 3. And in the last 3 months, again, we want it to be less than 2.5. The detection is very easy. It's by doing a simple test, and therefore it is highly recommended to do this test as soon as your pregnancy test is positive. Coming to what is the treatment is very simple. It's just one small tablet. The same hormone that is secreted is given in the tablet form. It can be started with a low dose, and the doses can be raised based on the TSH values. Since it can be detected and treated very easily, it should be done and never be missed during pregnancy to avoid these complications.